puffy ankles, high blood pressure. It's not a stroke. She's got severe preeclampsia. Yeah.
Where are you doing your prenatal care?
Nowhere. So wild pregnancy.
Free birth? I am dead set against free birth. No free births. Multiple babies have died from free birth.
Presents with the red GI secretion for the past 2 days. Patient.
Magnesium sulfate prevents seizures, labetalol to bring down the blood pressure. That's all good.
What's happening? You have a condition called preeclampsia.
Yeah.
And how did that happen? Nobody really knows actually.
10 to 15%.
High blood pressure, headache,
Yep.
protein in the urine, and swollen ankles.
It's a wild pregnancy, no medical care. Yeah, that's going to help you when you've got severe preeclampsia, for sure. Talk about unrealistic. Yeah.
Well, if we don't lower your blood pressure and treat with magnesium, there can be problems.
Like what?
Seizures, bleeding, even death.
That's right.
For you and the baby.
Those are all real risks.
Wow, the VIP thing.
Preeclampsia can be deadly sometimes. You got to take good care of those patients.
My eyes closed, but I will. Maybe one eye.
He's trying to be cute. Lighten the mood a little in a tough situation.
How's the headache?
10 headache. Fentanyl? No, you get the blood pressure down. That's how you resolve the headache.
Hey, Abbott. Attending resident nurse sent in the OR.
Sent down an OB nurse. Okay. I mean, obviously they paged the attending. No prenatal care. Not smart. Known to cause adverse outcomes.
Some jelly on the belly. Gonna take a quick look with ultrasound.
Oh my God. Okay, we need to pause here for a second.
Not true.
So, ultrasound does not harm babies. This has been studied extensively. We know for a fact that ultrasound does not harm babies because there are many studies on this, and there has never, ever in history been an episode anywhere published that an ultrasound harmed a baby. The idea that ultrasounds harm babies is utter nonsense. So, it doesn't work that way. It's not at a high frequency for the ultrasound. No baby has ever been harmed from an ultrasound. So this is total gibberish. I don't know where she's getting this idea from, but actually doing ultrasounds in pregnancy is proven definitively to reduce complications because you pick up on problems with the baby and the placenta and the growth and so on, so that people don't end up in exactly this situation.
I wanted a free birth. No doctors, no.
Oh, yeah. At least she's being cooperative. That's great. I applaud her for that. I get it. She wants it her way. No problem. We want everybody to enjoy their pregnancy, but not a free birth.
Yeah, with an infant mortality rate of 30%.
Okay, I gotta pause again. This is absolutely true, okay? The infant mortality rate, morbidity and mortality rate was 40% because of the lack of proper obstetrical care. So every time someone says, we don't need it, women have been doing this for thousands of years. Yeah, and half the babies died. They died. This idea that it can all be done naturally is just simply not factual. It is ridiculous. Sure, some low-risk women are gonna do great, and if you want to have an unattended birth at home, take a midwife, for God's sakes. Have a birth at home. Do it as naturally as you like, but have someone qualified there who can deal with that situation, or do it in the hospital and work with your OB like me, who will actually do whatever you want, but make sure it's done in a safe environment where if an intervention is needed, not that you need them, but if an intervention is needed, it's readily available.
7 centimeters.
37 weeks. Teleprovidence.
What? No. No. Absolutely not.
At 37 weeks, the cure for
Oh, yeah.
preeclampsia is to
Let's not induce, because that's actually the treatment for preeclampsia.
You and your baby.
No.
Yeah. You don't get a choice sometimes. I mean, you've got severe preeclampsia. You need to be induced. Whether you like it or not, you need to be induced. She's got all the blood markers. Obviously, we're going to be worried about her. This is now HELP syndrome, hemolysis, elevated liver enzymes, low platelets, as you mentioned. So 40 labetalol IV, that is a massive dose. We usually are giving it in 5s and 10s. That is a huge number. The LFTs are elevated. That's liver function tests. She's clearly got HELP syndrome now. The platelets are rock bottom. She's a huge risk for bleeding.
Oh, she's seizing.
And you know, of course, being a drama, the next thing you're going to see is this, which is a seizure.
By mask. Should we intubate?
And I applaud this woman. That is one of the best fake seizures I've ever seen in my life. She is doing a great job. That's literally what it looks like in real life. It's quite terrifying. And it's very, very nerve wracking if you're the doctor or the attending staff. You can see the baby's heart rate starting to dip down. That's obviously very concerning as well, because she's basically not getting sufficient oxygen, so the baby's heart rate goes down.
Not quite. 120 of propofol, 68 succinylcholine. Why is that, Cruz? Propofol for the anti-seizure
Now they're giving her
effect.
anti-seizure
Succinylcholine for arousal,
medications,
so we can check her neuron exam.
and they're
Exactly.
using an
First use
actual
propofol.
anti-seizure
Where's the
medication. We
flash?
usually start with Ativan, but they're
Yeah,
giving
so
the
let's see.
hardcore
Baby got both
stuff.
arms. Get the baby off the vena cava. Sucks is on board.
But after she's paralyzed, the seizing stops, right?
It might look like that, but an ongoing seizure will
Now,
still
by this
require the
point in
brain to
time, I
monitor.
mean, anyone rational would have called the OB down and an emergency, at least a resident, like get someone down there. I don't think there are very many emerges that are going to be managing a preeclampsia seizure in the emerge without moving the patient to OB. Now, granted, she's currently unstable because she's in the middle of this seizure, but they had time. I don't know why they didn't get at least a resident down.
Fetal heart rate borderline
The nurse is
78.
there, but the nurse is not allowed to order or administer drugs. So that's, part of the problem. She can only administer them if the doctor's said to.
EEG monitor's good to go.
That was fast.
They're holding her on her side, and this is important. So I'm just going to pause here for a second, because when you're flat on your back and you're pregnant, your uterus actually falls onto the inferior vena cava, which blocks blood flow from getting back up to the mom's heart and brain. And then because it's not getting enough, the body actually shunts more blood to the heart and brain. And so the baby actually gets less, which makes the baby's situation even more precarious. So they tilt them over to the left so that the uterus comes off of the vena cava.
What's she had so far? 30 of diazepam, full load of mag, keppra, and propofol. Damn, what's your next step? Any ideas? Nasally?
So she's tubed now.
Infusion is
They're
too
breathing
long,
for her. I've never seen that wild device that looks super cool.
She also helps in
And again, they're putting her on her side to see if the baby responds better, see if her blood pressure goes okay.
put the AV pads on just in case. And 10 of
Now they're realizing that even though she's paralyzed because she's intubated,
A little better.
she's still seizing.
She will be. After we break this seizure.
Cái problem
I love the fact that they're taking time to teach, but you're not really going to pause while you're asking a student to answer questions when the patient is having a nonstop seizure. That's probably a little unreasonable. So 104 is reasonable. We don't love it, but it's starting to come back up. Baby had a big decel, but because they're at least getting her to breathe now, the baby's getting the oxygen it needs again, which is super important. So now for some reason, she actually goes into cardiac arrest. This would be extremely, extremely unlikely under normal circumstances. I've never had a case where we had a seizure turn into an arrest before, but I mean, I guess it's for the drama.
We'll check a rhythm in a minute.
So these guys are going to gown up two emerge docs to do a cesarean section in the emerge department. So I got to tell you, like, this is wild. I've never even heard of this before. I've been doing this for 20 years. I've never heard of a cesarean section in the emerge. It's a little unrealistic. And I love the fact that he does not have a mask or a hat on. Like, smack some stuff on the guy, help a brother out. You can't operate with all these people in the room and there is no mask, no hat.
Still VFib. Clear.
And you've only got 5 minutes to get a baby out from the time that they are seizing. Now that right there, you got to pause. That right there is insane, okay? You cannot take your hand and smear prep on the abdomen because the abdomen is dirty. The whole point of the prep is to prep the abdomen so it stays sterile when you make a cut. If you're using your hand, you're just taking your hand and going from the dirty part to the clean stuff, and you're spreading the dirty stuff all over the place. So that was wildly unrealistic. You can just dump a whole bottle on, that's fine. Or you can take one of the prep sticks if you're fast enough and do that, but you are not going to spread it with your hands ever. Totally unrealistic.
Timely. Good. First incision is from the xiphoid
Oh
to
my
the
God.
symphysis.
Okay, so pause here
From the
for a
skin
second,
to
okay?
the
They are cutting
lymph
up
linear
and
outlet.
down on the uterus.
Infuser.
Very few people do that anymore. That is proven to be detrimental. Even in a true crash section, I can get into the abdomen and get the baby out in under 30 seconds by doing a fan and steel, which is a sideways cut. The up and down cut is horrible for cosmesis. It's a lot more pain. It's associated with more bleeding. I get it. They're emerge docs, so that's probably the way they were treated. Also, notice the dude with no hat on is leaning over the incision with his hair falling into the wound. But, anyways, I'll leave that for now. Get a freaking hat. Why can't they have a hat? They got everything else.
Second
Get a
incision
hat.
goes through the peritoneum,
Yeah,
exposing the uterus.
this is completely bonkers now. So the up and
Signs
down
of
cut.
bag mask, urine suction, stand by for intubation.
Bladder factors. Neonatal monitor or post-hoc ready to go.
Fellas, gentle traction.
Okay, you can't open it up that
Small
much,
vertical
but sure.
incision through the lower uterus so as not to cut the baby.
And now they're going,
Okay. Using
oh my
scissors
God, they're
to
going up
extend
and down on the uterus.
your
Ah,
baby.
okay, you don't do this. That lady
Fellas, hand retract the
is
uterus with me.
forever going to need to have cesarean sections for all time if she can ever get pregnant again, and will need to possibly be in the hospital because she just underwent a filleting of the uterus where they split it all open.
It's a girl.
And the baby is flat as a pancake. Now, with the baby flat as a pancake, you're not going to spend time doing delayed cord clamping. And cord milking, which is what he just did, is actually associated with an increased risk of neurological injury to babies. So we don't tend to do that anymore. So that baby needs like aggressive resuscitation. It is flat, no tone, no movement.
A little bit closer.
They're just keeping the oxygen there. You need to check a heart rate, which I'm not hearing yet.
Do we need to intubate?
Not yet. No, they usually pink up with stimulation.
They're
and
trying
blowback.
stimulation and blow by on someone that got like 30 milligrams of diazepam to stop a seizure. That baby is going to need to get flumazenil, which reverses the diazepam. So that's ridiculous. That baby would not come around just by its own.
You need a bag. Suction first.
By this point, we'd have an ICU team down there as well. This is not a emerge kind of thing in most circumstances. I mean, these guys would not be practicing this often enough.
Never seen it that low.
It's not as bad as it sounds. I'm more worried about the heart rate. Okay, get ready.
An
with that
IO?
PCB.
Why wouldn't they go through the umbilical cord? Who does an IO on a baby?
Rhythm check, hold compressions. Still B-fib. Okay, shock it. Clear. Resume compressions. Shen, how's she doing?
Okay,
over
so
there?
while all this is going on, what is happening to mom's uterus? Like, are they sewing it back together yet or not? Because she's bleeding. She's got platelets of 40. She must be hemorrhaging in there.
Not yet. O2 statin 60s is normal by 1 minute.
Heart rate and pulse-ox are trending higher.
Let's keep
I
going.
just don't get this at all. Like, this is wild.
Full compressions.
Completely wild.
Can't feel carotid. Heart's barely pumping. It's PEA. Back on compressions. Perfuse, 2 more units. She needs more red cells and platelets.
Now, you don't really know
Give me the lap pads we got, please.
what he's doing. He's just asking for lap pads. And look, they're stuffing the uterus because they haven't repaired it. So they filleted the organ that's been taking a huge amount of blood flow from the pregnancy, and they just left it open. Like, it's going to hemorrhage. It's going to completely hemorrhage. That's crazy.
Looks like sinus. And I got a weak carotid. Okay, cycle the BP.
This is just nuts. Where is the resident or the doctor? This makes no sense. Get a resident. Get a surgical resident, anybody. And that baby, they would have already been doing chest compressions on that baby. It has nothing going on there. Babies don't just suddenly pink up magically. This is just wild. I love this show. It's a great show, but like, I wish they had consulted one of us on this part. This is wildly unrealistic. Okay, that baby was down for about 4 minutes. There is no way it's just gonna suddenly start crying like that. That's not realistic. Oh, finally we got someone down here.
Status, health syndrome, cardiac arrest, resuscitation. So you are with a septic twin C-section. Shit happens fast.
Yeah.
Resuscitated hysterotomy in 36 seconds.
Impressive.
BP's 102 over 64, hemoglobin's up to 9. That'll do.
I just don't get it. I mean, great show. Love Noah Wiley. You're amazing. Please don't ever do an up and down cut on anybody, but we just wouldn't do it this way. I mean, there are better ways to do this, and it was great for drama, but I was sitting there the whole time when I watched it thinking, "What? There's so much wrong with this. This could be done so much better." But I guess they had to do it that way for the drama impact of it all. So, great show. Love the pit. Totally deserved your Emmy.